Good morning, everyone. It's good to see so many bright faces this morning. I thank you all for being on time, very punctual. My name is Tinuola Akimbolagbe. I would like to recognize the presence of His Excellency, the Honorable Coordinating Minister of Health and Social Welfare, here represented by Dr. Ismaila Adiatu, and His Excellency, the Minister of State for Health and Social Welfare, here represented by Dr. Obiajulu Ugbo. Distinguished ladies and gentlemen, it's my pleasure to welcome you to today's conference titled The Healthcare Investment Trend, Exploring Opportunities, Challenges, and Proposing Sustainable Solutions for the Nigerian Market. On behalf of the Medic West Africa team and the PSHAN team, I thank you for joining us for a day of meaningful dialogue and collaboration. As we gather here today, we're united by a shared vision for a robust and thriving healthcare ecosystem in Nigeria and beyond. The objective of this conference is to facilitate an open dialogue among key stakeholders in the health sector, including private investors, healthcare professionals, policymakers, and industry experts. We aim to share insights, discuss innovations, and forge meaningful partnerships that will drive the future of healthcare in Nigeria and indeed across Africa. The theme for this conference was carefully chosen to reflect the rapidly changing landscape of healthcare investments in Nigeria and beyond. And as we work towards improving healthcare access and quality, it's crucial to understand the opportunities and the challenges that are present in this market so that we can develop a framework to enhance healthcare access and quality. This understanding for the various investment opportunities and challenges is essential for sustainable growth, whilst providing an avenue to explore strategies for risk mitigation, technology integration, and investment in reshaping healthcare investments. The significance of today's panel discussions cannot be overstated. We're privileged to have a group of distinguished panelists today from across Africa who bring a wealth of expertise and experience to the table. Their insights on leveraging the Africa Continental Free Trade Area Agreement and unlocking the healthcare value chain in Africa aligns perfectly with our conference theme and mission. Our first panelist, Dr. Amit Thacker. He's the executive chairman of Africa Health Business in Kenya. He's a visionary entrepreneur who has been instrumental in integrating the private sector within the healthcare system in Africa. His experience in fostering effective public-private partnerships is invaluable to our discussion. You're welcome. Next, we have Ogogo Makinde. She's a partner at ALN Nigeria, Aluko and Oyebode, Nigeria. Her expertise in PPPs and regulatory compliance will provide a solid foundation for our understanding of how to measure success in healthcare projects. You're welcome. And finally, we're honored to have Nellie Ale. She's the head of health ecosystems at the Mastercard Foundation in Kenya. Nellie's performance track record in global health, healthcare financing, and strategic health programs will be instrumental in guiding our conversations on the future of healthcare in Nigeria. The panel discussions at this conference cover a comprehensive range of topics that align with the conference themes and goals, each providing unique insights into different aspects of healthcare investments and development in Nigeria and across Africa. By engaging in these discussions, we aim to explore the potential of the Africa Continental Free Trade Agreement in creating a robust health value chain across Africa, whilst also fostering innovation, public-private partnerships, and inclusive growth. So PSHAN was created or established. We started off as a roundtable, and we transitioned into an organization in 2015. And PSHAN has been in existence for the past 9 years. So we serve as a platform a business-led platform that mobilizes the resources and capabilities of the private sector to improve Nigeria's healthcare system. So this just shows a bit more detail of the earlier slides on the outpatient attendance, immunization, skilled births, and number of pregnant women registering. So I thank you all for listening and for giving us the chance to showcase the ADHFP, which is an initiative we're so very proud of. I thank you all again for being here. This conference provides a platform that will propel us towards a more resilient, innovative, and sustainable healthcare system which serves the diverse needs of our population. Through our shared knowledge, our collaborative partnerships, and our commitment to excellence, we can, emphasis, we can. I know it sounds difficult, I know it's extremely frustrating sometimes, but we can transform the Nigerian healthcare landscape and set new standards for the continent. Thank you all and enjoy the conference.
As you heard, my topic is going to be around risk mitigation strategies, really talking about the Africa Continental Free Trade Agreement and what that really means. So, I do want to talk about health investments and it's important in our sector. Dr. Tinu set the stage saying that more investments in health are necessary. So we need more money for health. It's pretty clear. But it's also very clear that we need more health for the money. If we continue as health team members and health champions on improving efficiency with the money we have, we can produce more health. You saw the Adopt a Healthcare Facility list that Dr. Tinu showed us. It showed us that there's an improvement in the number of women registering for antenatal care or the outpatient visits or even deliveries. What I would urge PSHAN to do next is to look at the efficiency per delivery and the efficiency per treatment. And if you can reduce the cost and produce better health, we will have healthier Africa. The problem happens when we start wasting funds with the volume of services that we give either in delivery or in vaccination or in outpatient. It's critical to understand the resources are limited. United States of America spends $10,000 per person per year for healthcare to look after its people. Europe spends $4,000 per person annually to look after its citizens for better health. Africa is struggling at the moment to spend $150 per person on healthcare. How much can we produce? What can we really do with that? We need to be efficient because we don't have the thousands of dollars that they have in those countries to test and potentially also waste. For us, waste of money means lives lost. Waste of money is chances of children and their survival down. We need our kids to live longer. Our life expectancy should increase. We need to make sure that a baby girl in Switzerland and a baby girl in Sierra Leone can have the same life expectancy. Not one at 48 and the other at 84, born today. We can do this together. At Africa Health Business, our mission is to create strong partnerships with public sector and private sector. Let's talk about sub-Saharan Africa, and we talk about the history that we've faced. Historically, we have faced a huge amount of burden, and you all know the situation with non-communicable disease, and communicable disease. We have been exacerbated by limited resources and infrastructure. We've faced two big hurdles in the last 20 years. And all of us are trying to bridge one of those two barriers. One barrier is financial barrier. And the second barrier is the geographical barrier. It's been so hard for at least 70% of our population to reach a qualified personnel to treat them effectively during the time of need. They've had to spend a huge amount to travel from rural and further places into the city where all the specialists are and where the doctors are. Second is we've had no insurance. How many people are insured in Nigeria? How many people are insured in West Africa? Every day, there's catastrophic expenses happening and households are sliding into poverty because of unexpected healthcare costs. We are all struggling. In Kenya, we had NHIF that slowly moved from 10% of Kenyans covered, where I am, to now 25%. We are still not able to raise the bar, and we have just changed to Social Health Authority to reform our programs to increase it from 25 to 75. Ghana, your neighbor, has also been trying to use 3% health tax and VAT funds to try and increase more funding for healthcare. Still struggling. Rwanda probably has the highest amount of their own citizens covered in Africa. Let's give them a round of applause. So they've done a great work. They have come out of the woods bringing health posts, but commitment from the government, from the exchequer to put on money to try and cover their people. Let's get back home to Nigeria. NHIA in Nigeria has had a long history and an extremely difficult history. Even now as we speak, they haven't cracked the formula of how to get at least 10% of the Nigerians covered. I hear they are at about 2 or 3, single digit. So, the giant of Africa needs to lead the pace in order for the rest of the billions. So let's help NHIA. I wanted to mention that. But today's topic is not about geographical barrier or financial barrier. Today's topic is about the Africa Continental Free Trade Agreement. The people who colonized us many years ago broke us into 54 pieces. The same people went back to their countries and united themselves as one bloc. Quite a paradox. In Europe, if you travel these days, you apply for Schengen visa. When you get a Schengen visa, you travel anywhere within. In Europe, they have decided to do away with central stores. In Europe, you can buy one license and you can sell your laparoscopic machine and Carl stores or whatever to all the countries through single registration. In Europe, you have intra-Europe trade accounting for over 60% of their trade. They buy everything made in Europe for Europe in order for the families to consume and be treated by equipment and supplies made in Europe. They came here, they told us we have to have boundaries, borders. $215 we paid to get from Kenya to Nigeria, right? Poland to go into Belgium is free. This is telling you one thing. Division is a disaster. Division is expensive. And division plays a role in reducing life expectancy. Every product you buy is more expensive because of division. Every equipment that comes into your hospital is more expensive because of division. Have you tried to import goods? You know what you have to pay to the revenue authorities? Have you tried to take goods from here across the border, how much do you have to pay? If you are a cement manufacturer in Nigeria, the large one, as you know, if they want to sell the cement to Benin, it's more expensive than taking it across. You cross the border and the prices go up. Healthcare suffers the same fate. And so the Continental Free Trade Agreement, ladies and gentlemen, is what we need in healthcare to change from the 17% intra-Africa trade towards the 60% like Europe. I'll talk about 4 things as I end up, and these are risk mitigation strategies. It is very clear that the legal team in Africa will have to work double hard. All the legal firms in Africa will have to step up, pull up their socks, work with the heads of state, work with the political machinery, and change the legal dynamics. If the lawyers don't help us, we are going to slow down for another 10 years. Confirmed. No two ways about it. Whether it is the Attorney General's chamber, AG, private lawyers, and I'm hoping that the message to ALN is loud and clear. Your work is cut out. Don't worry about your fees. Do it pro bono. Do it for Africa. But we'll give you a bit of funds, don't worry. The second one is economical. If we allow people to understand the economic benefits, many of you in this audience and organizations can package an advocacy message of the economic value of a united market. Number 3, we will have to use technology. These things are going to be so confusing and so tough. Let me tell you, to make products move from place to place, already we have trouble in our own country. Already we are struggling with what's coming through our ports. We are already seeing counterfeits and substandard products. Imagine now you open it up to big markets. Disaster. If we don't use blockchain, and we don't use AI, and we don't use technology, we are going for a head-on collision. Because those guys who are making money in the underground fashion will find a bigger market. And you know how they are. They are very creative. They'll be faster than the legitimate business people, right? So please, let's use technology and make sure that these kind of products remain safe. And now we'll need goodwill. If the political goodwill is there, if the political goodwill declines, and there are fights between borders, then no matter what you do, you can continue talking about this till the cows come home.
I would like to take the conversation from where Dr. Taka left it. I like the phrase that he left us with when he talked about Africans for Africa, by Africa. I think that's exceptionally phenomenal. And it's important that we begin to think about Africa for Africa and by Africans. I think Africa has come of age, and the free trade agreement is the foundation I think that we need. Not just in terms of the signatories, but implementing it and ensuring that we operationalize everything that's contained in that free trade agreement. The free trade agreement is so rich, and it presents a phenomenal opportunity for Africa to take our healthcare to the next level. And in taking our healthcare to the next level, one of the things that we struggle with is sustainable healthcare financing. And sustainable healthcare financing means different things to different people. We have a variegated understanding of what sustainable healthcare financing is. And a lot of times when we talk about sustainable healthcare financing, there's a tendency for us to look outside of Africa for Africans. And we see that increasingly the space outside Africa for Africans is shrinking. And so how do we begin to think differently Again, I would build on a foundation that Dr. Thacker has provided for us. The question is, do we need more money or do we need more efficiencies within the system that we currently have? And I think if we can demonstrate more efficiencies and more effectiveness, without necessarily increasing the size of the portfolio, we will get to that point when we honestly can see better health for Africans by Africa. So what's the concept of inclusivity in healthcare? When we talk about inclusion in healthcare, you want to ensure that all individuals, regardless of their background, have access to equitable healthcare. And when we talk about equitability in healthcare, you're not just talking about healthcare that's available to people. You're talking about people who have access to healthcare that they need. The way Africa is structured, we have different challenges across the various levels, from the primary level to the secondary level to the tertiary level. So when we're discussing equity in healthcare, you want to be sure that people have access to the kind of healthcare that they require. For some people, addressing challenges around maternal and child health is enough to raise the health indices of that community by 50%. For some more affluent communities, as we're beginning to see in Africa, we're battling with things beyond primary health care. Now we're looking at non-communicable diseases. We're looking at diseases of lifestyle, the diseases of affluence. We're looking at cancer care. We're looking at end-of-life care. So healthcare equity ensures that people, regardless of their race, their social background, their economic status, have the kind of healthcare that can make true meaning to them. For healthcare to be inclusive, you require a whole of society approach. It's a multifaceted approach. It's not a one-size-fits-all. So you are not able to sit outside of the community and outside of the climb to design healthcare that is truly equitable. And that's why I will continue to harp on for Africans, by Africans, with Africans, because we are the only ones who truly can design a healthcare that caters to the needs of Africans. So some of the PPP care models that we have in healthcare are PPP models that would attend to infrastructure. Some of them would look at service delivery, and some of them would look at financing or purchase of service, and others would look at other engagement options like capacity building for healthcare workers. Suffice it to say from here that none of these models on its own, as a standalone, is successful. So to ensure inclusivity, it's important that you have different components working together to be able to achieve the reduction in inequities that we see. And by them working together, you're able to achieve better efficiencies of scale. Next slide. Some of the bases for public-private partnerships and inclusivity will be access to healthcare. So you want to make sure that people have equitable access to healthcare. Not just equitable access to healthcare, you want to make sure that the resources are equitably distributed, as I showed in the previous slide. You don't want to also just have public-private partnerships in healthcare that address treatment options and rehabilitation options. For your PPPs to be effective, to ensure inclusivity, you're looking at issues around health education, health promotion. There is no healthcare that can be equitable that's not culturally sensitive. So you need to understand the culture of the people, and you have to work based on the culture of the people, because you can provide healthcare, you can address the demand side, but you don't have people using those healthcare facilities because they're not culturally relevant to them. We have climes where people will prefer to be attended to in birth by women. And you equip a clinic and the healthcare personnel are all male. What that says to you is, while the services are there, the uptake is going to be minimal or non-existent because you have not culturally responded to the people in such a way that you encourage them to utilize whatever you have provided. Community engagement and empowerment is extremely important for you to have a sustainable public-private partnership. The community needs to have a sense of ownership. They need to have a sense of belonging. There is the part in public health where we say, not about me, without me. So you cannot decide for people outside of the people without involving the people. So in looking at the opportunities that exist for public-private partnerships, we have an opportunity to identify gaps and inefficiencies. We have an opportunity to make our systems more effective, to make our systems more efficient. We have an opportunity in public-private partnerships to improve support for evidence-based decision-making. A lot of times, we want to make decisions outside of just political will and capacity for people to put resources together. You want to have a science behind the reasoning, and these are areas where private organizations can work with the public sector and strengthen. We also have an opportunity to promote innovative financing mechanisms for sustainable health financing. When I started, I talked about the dwindling or the shrinking fiscal space outside of us. And so the public-private partnerships are a more sustainable option in terms of sustainable financing mechanism. They can definitely add to the portfolio of what we have. And then in public-private partnerships, we also have an opportunity to measure and demonstrate impact. One of the slides that was presented in the opening remark was looking at the impact of the adopted primary health care facility. And that spoke to the impact, the difference we have made just by being there in a few months of operationalizing those healthcare facilities. And so, through public-private partnerships, we have an opportunity to track our investment. We have an opportunity to demonstrate the return on that investment and demonstrate impact in terms of health indices improvement for the community where these healthcare interventions are implemented. Finally, I'll leave you with a quote that says, health equity is achieved when every person has an opportunity to attain their full health potential. And no one is disadvantaged from achieving this potential because of social position or other socially determined circumstance.
In my presentation, what I've tried to do is to, apart from discussing the PPP options for healthcare and how to improve outcomes across Africa and Nigeria, I've also just talked about PPPs generally, but first of all, highlighted the depth of the issues. I think all of the issues are well known to everybody in this room, so I'm just going to run through some slides that Dr. Taka and also Dr. Ann had more or less highlighted that have similar statistics. So on this slide, what we have here is a description of PPPs. I'm not going to talk too much about it because Dr. Ann had already done a really good job about talking on PPPs. They're widely available across sectors, which is good. I mean, PPPs are as old as time, particularly in Nigeria. We've always had one form of PPP arrangement or the other. But in the last 20 years, we've tried to standardize and to have regulations and laws. So you have laws on the federal level and laws also at state level. Some states do it better than others. It's an ongoing process, and more changes is expected. So I mentioned an ongoing PPP scheme that Nigeria has right now, which is an infrastructure development scheme that is done with the federal inland revenue that basically gives tax concessions to companies that take on large road projects. For the legal framework for PPPs in Nigeria, as I mentioned earlier, you have on the federal level and at the state level. I am proud to say that my firm participated years ago, about 17 years ago now, to draft the first Lagos State PPP law, which has since been improved. Lagos State is really a market leader in Nigeria on PPP arrangements and how to deploy investment capital into social and infrastructure projects. Now, how can PPPs be successful? We have had a checkered history with PPPs. Some have been successful, it's been a checkered history right from the federal level up to the state levels. And there are different reasons why a PPP project will go wrong. The most important wrong really is a misalignment in risk allocation. Who is most suitable to bear what risk? It's so important, and that's where the lawyers come in. Sometimes on the private sector side, we are working to ensure that, look, all of the risks as much as possible is pushed onto the government side, which is why the comment I made earlier about good quality legal services, both at the state side and the private sector side, is critical, because there has to be a proper alignment of risk. There has to be a proper allocation so that not one party is taking on a risk that really are not properly aligned with its obligations. On this slide, I mentioned some of the PPP projects that we have seen. The adopted healthcare one is right at the top. I work for MTN, so full disclosure, that's another really successful one. Lagos State, Lagos LUT, and I think the UCH and LASU, they all have different projects. The value chain is so vast, really. So they all have different PPP projects along their value chains, from the services to pharma to diagnostic. It's all is different. The Bagada one, I think, has had a check at the history. I'm not sure it's actually still functional, but it was a really good one when it was functional. And we worked with Farm Access on this Delta State Healthcare Commission back in the day. We work very closely as well with Edo State government, and Edo State is doing really good things on the PPP side along education, infrastructure, and healthcare. So as I said before, some states do better than others, but what we want to achieve really is across board, multiple states doing these projects and being comfortable doing them, because ultimately the outcomes will be better for citizens. Next slide, please. Metrics for measuring the success of PPP projects. I'll spend some time on this topic because it's so critical. The distrust that the public has for this project is because sometimes the aim or the objective does not align with reality. And again, pricing is an issue. So the health outcomes, when we advise on PPP projects, health, infrastructure, road, across sectors, what we typically would advise is, what is the objective? What are you trying to achieve? Break down the objectives into achievable goals and milestones, because the users of the facility need to buy in. They need to see from the low-hanging fruits, then as the project goes along, they need to see that more and more is being achieved. And a lot of that goes into the legal drafting, because there's also a big cause of disputes. And the disputes always make the news, which again increases the distrust of the public for PPP projects. So it is important that the outcomes and the objectives per project is set out properly and dimensioned. Again, it goes back to the design stage and the conceptualization stage that I mentioned earlier on. That involves a whole lot of clever people that are cleverer than me, but everybody needs to be in the room designing and conceptualizing how the PPP project would be implemented, and all of that needs to be in the agreement and program schedule. The access to the services, who's using the service, who is the service for? Data, as Dr. Ann said earlier on, is poor. We work on road projects and we ask for road traffic data, and there's none. And meanwhile, I mean, there are 25 billion odd people living in the city. So data has always been a challenge, and the investor does not want to bring in funding on a blind slate. The problem is, where there's no data, the risk fall more on the public side, because investors do not want to take on risks that they are not aware of. But we do tend to see that when there's a buy into the project, as the public starts using the project, the private sector, the private investor they're really good in keeping the data. And with the technological improvements that we have seen over the last 10 to 20 years, the way to collect the data has really significantly improved. So who is using the services? What are the patient numbers or road users? Really, these are matrices that cut across PPP projects. So I'm not going to limit myself to the healthcare one. What is the geographical coverage of the facility being provided? What are the competing facilities around that? Because that could be a drag on the PPP project. And those are the kind of risks that are usually put on the public sector's side of the contract, so that they ensure that competing facilities are reduced to the barest minimum. In healthcare, which is different from a road project, the competing facilities dynamics really is not the same, in the sense that you don't want access and more facilities depending on the population in an area, which again leads to what is the profitability. So if we're going to have healthcare facilities by every square mile, that really diffuses and reduces potentially the profitability for the private investor. So who is going to fund that? Because even though the service is quasi-free, somebody's funding it, and the private investor wants to get a return on their investment. I thought it would be useful to put in a slide on types of PPPs. There are all different types of PPPs across the legal landscape. So and depending on the type of service, depending on the facility, it could be a lease from ports PPP. It could just be a lease where you pay leases to the government party, or it could be you build, you operate, and you transfer after a concession period. It could be a concessioning. It could be a build and you actually own, then you transfer. It could be all the different types of PPPs are listed in this slide. What is important is, from the conceptualization stage, the type of PPP model adopted is important, and that would involve a critical analysis of the facility, the economy sector, and the service that's being provided. So you don't just pick up a concession agreement and you use that without ensuring that it aligns with the type of sector, the economy, and the facility that's being provided. That really could mark or mar a project if the wrong model is utilized. Next slide, please. And that is all. The really small print is a disclaimer, so you can't sue me for anything I said today. Thank you very much.
As the moderator for today's panel discussion for these esteemed panelists, I'd like to extend a warm hand of welcome to everyone who is here. And we will look at talking about the African Continental Free Trade Agreement, the AfCFTA, for which Dr. Thacker had laid the foundation for us this morning very succinctly. And to let you know that the AfCFTA presents a unique opportunity to unlock the healthcare value chain in Africa by fostering economic integration and facilitating cross-border trade and investment. AfCFTA can play a pivotal role in driving growth and development in the healthcare sector across the continent. So today our panel will delve into the potential benefits and challenges associated with leveraging the AfCFTA agreement to strengthen Nigerians' healthcare sector. They will bring with them the diverse experience they have across the world and across Africa to look at the comprehensive understanding of what the trends in healthcare investments and how the AfCFTA agreement can be leveraged upon to optimize the healthcare value chain in Nigeria. As part of this conversation today, Dr. Amit Thacker will guide us through balancing risks and reward in health investments in sub-Saharan Africa. Ms. Nelly Ale will address evaluating the cost for equitable healthcare access through public-private partnerships in Nigeria. We spoke a bit about this in the morning, but there is never enough to talk about in terms of public-private partnerships. Dr. Tinuola Akinbolagbe will share insights on leveraging cost-effective solutions across the healthcare value chain with the expertise she brings from many years in the frontiers of PPP. You'd agree with me that she's very critical to this conversation. Ogogo Makinde would look into developing metrics and indicators for assessing the success of PPPs in Nigeria. And I think she's very familiar. She's on familiar tough when we talk about measuring indicators. So I'm privileged this afternoon to moderate this panel. And I know that the esteemed audience will engage with us in the second session as you did in the first session. So let's explore these topics together, share our experience, and propose sustainable solution. Thank you all, and welcome to an exciting afternoon of conversation. So I'll go over to the panel, and I'll give them 1 minute each to talk about some of the areas that they will engage with us on this afternoon. So I'll start with Dr. Amit Taka to open the floor and begin the conversation. 1 minute, Dr. Taka.
Thank you so much, Madam Moderator. And thank you so much for getting us engaged and getting on with the flow. What my topic is risk, balancing the risk and reward for the Africa Continental Free Trade Agreement. I'll just mention 2 or 3 things of what I said in the morning and end up in my minute to talk about what I see as the future. Division is expensive. Unification is critical. If this framework allows us to be united, then we are one Africa, one continent, one market, stronger trade. Every enterprise in this continent will start seeing a larger market where you don't have to look for the Chinese market to sell your avocados, or the Spanish market to sell your cocoa, or to travel to India for medical treatment, but the same or even lower cost to travel within Africa to look after your family and yourselves. And my parting shot is Continental Free Trade Agreement should bring the cost of healthcare down, and it should make UHC more available to more people in every part of our continent. Thank you.
Thank you very much, Dr. Thaka, for laying the foundation. We are going to go on to Nelly, who will follow on very closely with Dr. Taka's foundation that he has laid very efficiently for us. Nelly.
Wonderful. Good afternoon, everyone. Those energies need to be up. Good afternoon. Fantastic. So I'm very delighted to be here. Thanks for having me. And to just continue the conversation, I'll look at how are these cross-border barriers really causing irregular regulatory consistencies and impacting the flow of the medicines, the medical devices, and what strategies do we need to put in place as Africa to overcome that? But also, what is AFCTA's role in alleviating the access and the quality barriers to healthcare? That is what I'll focus on. But I must charge us as Africans to say that when will we write our own story? I think we are tired of the narrative of this is the continent with 25% of the global disease burden. This is the continent, where there are access barriers. When shall we change our own narrative, right? When shall we arise and leverage the demographic dividends, which is our young people? Our young people, the greatest assets we have. We have brilliant minds. I think, if anything, the AFCTFA, the Africa Free Continental Trade Area, yes, it's focusing on trade, but I think if there are bigger barriers that we need to overcome, and it will take each and every one, is the mental barrier.
Thank you very much, Nelly.
Yes.
Yeah, for reminding us that as Africans, we need to tell our own story. But I'm going to skip Ogogo and go over to Dr. Tinu, because Ogogo would look at measuring some of the foundation that Dr. Akimbolagbe is going to lay for us in terms of proposing cost-effective solutions to this oneness within Africa through PPPs. So how can we, just to lay the foundation for this discussion around ensuring cost-effective solutions through the trade agreement through PPPs in Africa?
Thank you for the question, and thank you for having me. It's a good question. How do we get cost-effective strategies as part of the PPPs? To be very honest, I'd like to use examples from the current administration's health agenda, where they're looking to have a sector-wide approach to deploying some initiatives so that we can have UHC in some form at some time in the foreseeable future. So if we apply that to the whole of Africa, and we look at the markets across Africa, and we look at the economies of scale that could come to be using all those markets together. Given an example with like pharmaceuticals. So every country has their own rules concerning what can be manufactured, what can be sold, how it can be sold, how it can be distributed. But when you look at that on a regional level, it's interesting that it may be easier from a logistics and procurement point of view to ship something, for instance, from Cameroon to Calabar than from Lagos to Calabar. So those are some of the benefits that we see. That's just an example. Those are some of the benefits that could be brought to play when you look at things like vaccine chain, you look at things like regional integration of a sort. So I know that the Africa Continental Free Trade Agreement sometimes looks daunting when you look at it from the point of view of 55 countries. But when we start from a smaller regional approach and we look from the point of view of West Africa, from the point of view of East Africa, then that's a bite-sized portion that we could use to roll that out. Thank you.
Okay, thank you very much. So we'll hold those thoughts there, and then we'll come back to you shortly. So I'll circle back to Ogogo to lay the foundation for how we can measure impact of the AFCTA, just looking to lay the foundation for the conversation we're going to have.
Good afternoon, everyone. Thank you for that question. I think that measuring impact and the matrix for measuring the impact of anything that we do is critical to even undertaking any project, and more so for PPP projects where public buy-in is critical. Public buy-in and public trust is so important for the success of PPPs and for even deepening the legacy and institutional knowledge of PPPs in the country. I think for us as lawyers in structuring these transactions, we try to build into the PPP transaction and project documents the measurable metrics and milestones. So it has to come right from the regulatory, right from the law, then also going into the construction and operational stage, depending on the type of project. You want to ensure that at every level of the project, there is accountability, there's data gathering, and there's also metrics for measuring the success, the user rate, the density, and also, very crucially, how the public trusts such projects. And I cannot emphasize enough the importance of technology in this area. The technology, as I always tell people, is going to save us in Africa. So we can utilize technology, and luckily for us in Africa, we do have a bigger percentage of our demographics in the younger generation, and they are the quickest to buy into technology. So technology must be utilized as well for measuring metrics. Thank you.
Thank you so much, Ogogo. In laying that foundation, you've already begun to touch on some of the meat of the conversation we're going to have within the next half an hour. Again, laying the foundation, talking about the reason why we have paralysis. For Nelly, it's a good place for Nelly to take over. So Nelly, if you could share with us from your experience, what are some of these cross-trade barriers across countries in Africa? What exactly is it that's hampering the inflow of health goods and services across the African region? And how do we mitigate these barriers in such a way that we can move from just talking to practicalizing some of these solutions that you will be providing here today?
Wonderful. Thanks for that question, Dr. And I think number one is, and it had been mentioned, the regulatory environment. It does not create an enabling environment for local manufacturing. Why? If I manufacture my drug in Nigeria, I get approval here, and it's a long process. In the next country, I will still have to do the same process to get approval of that same drug. And also, chances are it's disapproved in that particular geography. So, one, it's an inefficient process because the regulatory environment is very fragmented. The second thing is, what is incentivizing investors, as Dr. Thacker has said? How is our enabling environment incentivizing investments? I think beyond even the Africa Free Continental Trade Area, it would also have to take a multi-sectoral approach. Because if you need manufacturers and production, you need power, right? You need human capital, you need trained workforce. So there are so many factors that you need for that to hold true. And yet we have a huge, huge workforce. So how do we begin to build capacity of our workforce to enable production locally? And then the third thing is we have to incentivize research and development. Show me one center in this continent that is funded, for example, by governments, that is quite robust and is doing research and development. I bet you will not find. We cannot go into local manufacturing without research and development as a backbone. And these are things that governments can really play a role in. In Europe, in the UK, they really play a big role in terms of supporting research and development, the clinical trials that need to be done. However, there is hope. One of the strategies is that we have the Africa Medical Agency, which is headquartered in Kigali right now, that is seeking to harmonize this regulation. That's where our clinical trials will get approved. That's where our molecules will get checked and inspection. So there is hope and we are getting there. But I think we need to accelerate the pace. Yeah.
So thank you for talking about accelerating the pace. I would move over to Dr. Tinuola to share how it is possible for us to accelerate this pace. I know the AFCTA is over 15 years. So far, 8 countries have operationalized out of the about 42 countries that have signed up. So we have a lot of signatories, but operationalization is an issue. Nelly just talked about hastening the pace for which we're picking up things. So how do you think that we can hasten this pace in terms of operationalizing this AFCTA across countries?
Thank you. So I think my co-panelists have already started answering this. Dr. Taka gave a few examples, as did Nelly. So I'll just expand a bit on what they've said. I think the regulatory climate is very important. As you said, if we have all the NAFDACs of Africa come together and agree on a set of rules, this is what is required for you to produce pharmaceutical products in East Africa, West Africa, where have you, that would be acceptable. And they agree to harmonize their standards and their requirements. And that is then cascaded through all the countries in the region. That, for an example, is how we could accelerate pharmaceuticals. The second one being financing. How do we get the financial sector to be interested in actually investing in healthcare? A lot of people speak about the medium to long-term investment turnover period for investments in healthcare. But the finance sector also recognizes what we call cash flow. So even if the returns are going to be over a medium to long term, if there is something that is put in place and there is a high volume of cash flow, it is also attractive to the finance sector to invest in. So a second example would be health insurance. The people in Nigeria are not that much different in terms of human physiology from the people in Cameroon, from the people in Benin Republic. So if we have a set of rules concerning the type of healthcare insurance that can be deployed, a basic standard package, then you can encourage both international investors and local investors. Domestic investing is very important. You can encourage everybody to invest in health insurance for the region, and then you can have cross subsidization, which is not just then limited per country, but it is actually across the whole of Africa. So if I'm an investor and I find out that if I invest in some type of health insurance, a third-party administrator, I can deploy it across the whole of Africa. That would be exciting. I'd be excited to put my money in, even if I have to wait for 5 to 10 years to get decent returns, because the cash flow would be there.
I mean,
those are two examples.
I honestly think that
of
that's
how
a
to
good place to
accelerate.
leave it for
Thank you.
Ogogo, who would look at encouraging investments using the science behind the number. As we know, there is very little or no investment sustainable that can happen if you do not have a science behind the numbers that you bandy around. And I know a lot of times we're quick to say Africa contributes to 25% of the global disease burden and all of the indices that we bandy around. But when we come to investments in health, we see that this data, even what we have, is absolutely fragmented. So how can we monitor? How can we evaluate? How can we encourage investments through using science behind the numbers that we bandy?
Thank you for that question. I'm going to take in answering the question, I'm going to take my lead-in from what Nelly had said earlier on about research and development. Even though traditionally in Africa, research and development would be funded or promoted by the government, the fact of the matter is it is a big area where private investment can come in as well. There has to be proper protections. Research and development leads also to data. It's a huge avenue for collecting data. Private investments can come into research and development, but intellectual property rights need to be protected. I know that I call it after can help with that, because investors need to get the assurance that when they invest in R&D, their IP rights are protected. You have proper legal systems and due process where IP rights can be protected. You have registries where IP rights can be registered, and that governments are really critical in stopping fake manufacturing. We have a lot of bottlenecks with exportation and importation and movement of goods around Africa, but fake goods seem to move around fairly quicker. So there has to be a commitment to ensure that when the borders are being policed, they're not policed for the real goods, they're policed for the fake goods. But all of the logistics and the systems that have to go around protecting IP are important for investors, because investors want to know that when they fund R&D, when they fund data collation, when they fund these projects, their rights are protected, contractual rights are respected, and IP rights are respected.
Good afternoon, everyone. I'm Dr. Jimemole, as I've said earlier on. It's a spirit-filled afternoon with the discussants, most especially Dr. Amit Taka, who give Nigeria a hope that Nigeria has risen, and it has risen indeed. From my contribution to your discussion, earlier when Mrs. Makinde do our presentation, there are some infrastructure which I can identify from our discussion, which at the end of the day will be more useful to solve some of the problems that we are discussing. Not about healthcare alone, and it will go to other sector of the economy. And that is one, the BOO, builds, own, and operates. They are very fantastic infrastructure that she has identified. That is build, operate, and transfer. One, there are a lot of it that she identified there in her analysis. Then I wanted to ask, how well could you apply this to solve some of this problem that we have been discussing all along? And then apart from that, your discussion, I don't see it as if it has taken the people at the grassroots into consideration. How do you incorporate those at the grassroots into your plan? Thank you.
Okay, thank you. Let's take a few more. Let's take a few more. Let's take a few more. Yes, please. Let's take a few more, and then the panelists can address at once.
Good afternoon. I'm Olabanji from Olabanji & Co Consults, patient safety consulting firm. So thanks for the opportunity. My question is there any collaborative approach between as regards the Africa Free Trade Zone with other critical stakeholders in ensuring that there will be, okay, sorry. I said, is there any collaborative approach with the other critical stakeholders to ensure that this Africa Free Trade, we have a single currency when we have this free trade, so that the currency will not be another impediment to achieve our laudable program. Thank you very much.
Good afternoon. I'm pharmacist Yetunde Oyenuga. My question goes to Dr. Taga and Mrs. Nelly. I actually chose B, and I have my reason for choosing B. Nigeria is rising. We've not risen, actually. Being a pharmacist, if we remember, sometimes back, GSK announced, permit me to say this, GSK announced their production, that they're stopping their production, or they're stopping their manufacturing companies in Nigeria. So after that, I took a keen interest going to pharmaceutical companies, trying to check their activities, looking into one or two things. And to my surprise, 2 weeks ago, I was at Ibadan, that is Southwest, and I saw some pharmaceutical industry. They have facilities for beta-lactamase, and they've not been approved. Yes, two pharmaceutical companies for that matter, Southwest or your Ibadan, and they are struggling with approval. So when I saw the facilities, it was huge, billions of nairas. If they have everything they need. But the problem is approval for going to 2 years now. So what I'm trying to say is that the money is sitting down there. The machines are not working for now. That is that. Number two is Mrs. Nelly. She spoke about, I'm so sorry, I'm trying to, selling Africa. I believe in supply chain. I think that is one of the factors that we need to use to sell Africa. And that goes to some of our doctors writing brands and not generic. That is one. Two, some believe that drugs from outside the country works better. And that is false. And that the ones we produce here does not work better. So I want us to encourage and talk to some of these pharmaceutical companies, manufacturers, producers, to work on their supply chain and their marketing strategy. Thank you very much.
So if we could take 2 more questions, the panelists can address the questions, and we will try to wrap up.
Thank you very much, Ma. My name is Tosin Paul. I think I just have a question, just one, and it's directed to Ms. Nelly and Dr. Tinu. Yeah. So it's basically for healthcare solution providers in Nigeria or in Africa. How do PSHAN and we're talking about health investments here, and how do PSHAN actually provide opportunity for these startups, for these solution builders to access funds to drive their. Okay, we also mentioned the issue with getting grants or loans from banks and all. How do we get funding to sustain this solution, to drive it to actual success? Thank you.
Can we take one last question, please? Just one last one. Which the guy who stood up, oh my God.
All right, thank you so much, the moderator and very brilliant panelist. My name is Cosmos. In your preamble, Dr. Taka, you had mentioned that the colonial masters had the opportunity of disintegrating the African continent, and of course, which is so up to today. And the European Union have been able to unite, to the extent that Schengen country, you can have one policy, one visa to go around. Now, my question is this. Is there any plan within this scope where, like Dr. Tino has mentioned, the African Union, is there any plan, towards, leveraging the African Union, if they still exist, to help us integrate us as Africa? Because I've known a couple of proponents of this, the theory you brought up for Africa, in Africa, enjoyed by Africa. I have a mentor who does that, right? I want to know, is there anything you've done or the the trade free zone is doing to help Africa unite? Because Nelly did mention also, we should get to a point where we drop our caps. I'm a Kenyan, I'm a Nigerian, I'm a South African. We drop the caps and see ourselves as an African, towards what we're talking about now. Thank you.
Okay. Thank you very much. We apologize that we're not able to take all the questions, but trust me, the panelists are around and we can meet with them individually to have a conversation. I'm going to allow them to address the questions that have been asked by the audience, and then we will quickly wrap up the panel and we can continue to have the individual one-on-one engagement with the panelists.
Thank you so much. I have a few responses. One is, let me go from the person who talked about the colonial masters. Is there scope? I want to answer your question. There's Agenda 2063. And even in there is something called the African passport. I have actually seen the design. There is a movement towards having an African passport where you then don't need to create visas in any way you go. But it's the political will that is bringing it down. To make 4 or 5 presidents agree on one thing is already a challenge. Now, can you imagine bringing 54 presidents? So we have an issue of a mindset. The leadership mindset in our continents need to change. Is there a plan? The answer is yes. Is there a desire? Yes. Is Africa Union alive? Yes. Can we strengthen it? Yes. We need people like you and many others to start taking up jobs and drive Africa Union as a powerful force. At the moment, it's not the power of Africa Union. You can score it out of 0 to 10. What score would you give it? 10 is the most powerful, 0 is useless. Huh? Number 1, 2. And European Union, how powerful is it? 5, 6. You see the difference? 11 out of 10. Second one is, I just want to talk about, can you address what we are talking about, all of us? It looks like we are talking about other people besides grassroots. You are not addressing grassroots. I want to clarify that if the cost of medication and supplies and equipment goes down, it will make the grassroots feel that healthcare is affordable and more quality. So, to address your question, how many times do you go to a public facility and feel that there is out of stock, medicines out of stock? Many times, all the time. In fact, sometimes women don't go to the clinic because if they go, they're going to get nothing. If the cost comes down, hopefully, it will affect the grassroots. Healthcare will be better for the people in the community, and it will be more affordable. I think we were talking about all, not only grassroots. My final answer to you was about the infrastructure and what are our views with this wonderful presentation that we received on PPPs. And we saw PPPs. Today I learned so many new terms, but one of the terms you talked about was BOT, Build, Operate, Transfer. I think as governments, if they get the agreement right, it is a wonderful way to build our infrastructure. Whether it is a foreign investor, whether it's a local investor, but the numbers must add up. We should not go to an agreement like in mining. You know, in mining, we made a very big mistake. We make very many big mistakes and we let foreigners come in, dig everything, we get only a small portion. So we should negotiate so that we are not taken advantage of. If you are building a road or a bridge, or you are building, your PPP agreement with the lawyers should be clear on how you build, how these people will operate, then eventually it will be transferred. Remember, this infrastructure belongs to the country. Eventually it should have a transfer, but you should not put your children in debt for it to be transferred. If you do that, I think BOT is a very good model. Thank you, Madam Moderator.